Today we'll see about appalling amputation. The causes for appalling amputation are mainly for correction of congenital deformities, tumors, and trauma. Upper extremity amputation tends to have in the patients who are older than 60 years, but they may be required secondary to tumor or medical disease. Types of upper extremity amputation. The fingers are partial and a transphalangeal or a disarticulation below elbow. It is a transradial amputation. Elbow disarticulation through elbow joint. Elbow transfemoral amputation. Shoulder disarticulation through shoulder joint. Interscapular thoracic. Removal of entire shoulder blade. Then sites of amputation. These are the sites of the amputation. Amputation is middle of the forearm. Then there is a transradial disarticulation of the elbow. Second episode, disarticulation of the elbow. Then the amputation of the elbow disarticulation. Finger amputation. Mainly for first procedure is the finger amputation. PAP joint. Second is a stump to carry the fingers. Third is a better amputation than most satisfactory type. Then the amputation, four types of amputation better to remove into third metacarpal. Upper limb amputations, rehabilitation goals. When managing the upper limb amputee, the rehabilitation goals are to promote healing on the residual limb, then achieve the independence, self-feeding, toileting, and oral hygiene. Provide the patients and the family education in the rehabilitation process. So, management point of view, by training the self-feeding, toileting, and oral hygiene are introduced as soon as possible. Various commercial and customer adaptive equipments are processes that we use it are presented to the facilitate the independence in this area of delivery. Then regaining the sense of independence is the basic self-care task can assist the patients emotionally the recovery both physical and psychologically. Then the initial training takes place with the upper extremity in the relaxed position of the near the midline. As the client develops control of this plane, introduction of the limb placement in the various conditions are initiated to the stimulate reaching to height across midline or the floor. The client endurance should be considered during initial motor training such as the isolated muscle without fatigue. When training the client on doning and doping of the myartical processes, the reduced friction doning, the prosthetic doning system result in the intimate fit on the residual limb within the socket into the optimal electrode contact. Then processes. The process is a device that is designed to replace as much as possible the function or appearance of the missing limb or body part. It is a device that is designed to support, supplement, and augment the function on an existing limb or body part. Then classification of the process is the two main types: endo process or exo process. Endo process mainly for implant used in the orthopedic surgery. This is example of the osteoinject processes for the total hip replacement. Exo process is usually for artificial external artificial limb. That is the first picture is shown of the total hip replacement in the endo process, the osteoinject process. Second picture exo process is mainly for after the amputation the fit the artificial limb. This exoskeletal process mainly for ebony processes, resin material. The second one is a polypropylene process material. Then there is the endo process material. The prosthetic options, there are 6 basic prosthetic options. One, no processes, cosmetic with restoration, body powered processes, electrically powered processes, hybrid processes, then activity specific processes. And types of limb processes: passive or cosmetic processes and functional type. The passive or cosmetic type is the cosmetic processes can look extremely natural, but they often are more difficult to keep clean, can be expensive, and usually sacrifice some function for increased cosmetic appearance. Then types of functional processes: body powered processes, that is the cable control; externally powered processes, electrically powered. There is a myoelectrical processes or switch control processes. So body powered processes. The body powered processes use cables or harness strapped to the individual to mechanically maneuver the artificial limb through muscle, shoulder, and arm movement. While they are highly durable, they are often sacrifice the natural appearance for moderate functionality. The user experiences direct control and feedback through its mechanical operation The process can be fatiguing. The externally powered artificial limb are an attempt to solve this physical excursion through using battery and electronic system to control movement. This technology is the myological processes. The body part process usually for moderate cost and weight. They are most durable processes and have higher sensory feedback. The body part process more often less cosmetically basing the myological control type. It requires more grasping movement. So all conventional body-powered upper extremity processes have the following component: socket, suspension, control cable system, terminal device. Components for any interpersonal joints needed to according to the level of amputation. So externally powered processes, process powered by electrical motor may provide the more proximal function and a greater grip strength along with the improved cosmetic appearance. They can be heavy, expensive. Patient controlled batteries and motors are used for this process. Currently available design generally have less sensory feedback and require more maintenance and do the power process. Externally powered processes are required control system. The two types of the commonly available control system are myological and switch control. Okay, so thank you.